In this video, we'll talk a little bit about breast augmentation, which is sort of one of the most common and popular procedures that plastic surgeons perform. I'd say in my case, of the non-facial procedures performed, it's definitely the most popular. Second is probably tummy tuck, but breast augmentation still is the most popular because it's a very straightforward procedure. People get very nice results, and it's quite predictable, really. So when patients come to me to ask about breast augmentation, there's really a lot of questions that they have. And fortunately, there's a lot of information on the internet about this. I say the quality of the information on the internet has gotten better over time, but there are still some misconceptions out there. So I'll try to clear a couple of these up in this video. First of all, really the idea behind breast augmentation, as most people know, is really to put in an implant just underneath the breast to really push the natural breast forward. And in that way, really augment the fullness and sort of the contour of that breast area. I'd say best candidates for the procedure for breast augmentation, usually women who are relatively fit and have really just specifically just the breast area that they would like to have a little bit more full. I'd say of my patients, they're really divided into two types. One are where the breasts are really kind of in nice normal position and they just want more fullness. And the second category is patients for whom maybe they've had some weight loss or have had pregnancy or breastfeeding. And in those cases, the breasts are actually sagging a little bit and they feel they've lost a little bit of volume. That second category is different because those patients may also need a breast lift, but that really depends on what I determine during the consultation. So that's one reason why I think it's important just to see what the doctor has to say in consultation to really determine the best procedure. It's not always just a straightforward breast augmentation. Anyway, getting back to breast augmentation, when like as I mentioned before, sort of those best candidates, people come to me with a variety of questions, and I think when they first come, there's a couple things to think about. I tell patients that there's a few decisions I'll have to make. The first one is sort of the location of incision. There's three standard locations of incisions where people do breast augmentation. The first is the inframammary fold incision, or sort of the under breast incision. The second one is sort of periareolar around the nipple incision, sort of usually on the bottom half of the nipple. And the third is the armpit incision. I'd say for me in my practice, probably about 85%, maybe 90% of patients choose the under the breast incision. And the reason for that being mostly because it really looks great. The incision is really well hidden underneath the breast, especially after the implant has had time to stretch out the breast tissue, sag a little bit over the incision. The incision is really hidden and almost imperceptible. Second most common, probably periareolar. I'd say probably in my practice, maybe about 10% of patients get that. And for a transaxillary or the armpit incision, maybe about 5% of patients. Other advantages of the inframammary incision, I find that for me as a surgeon, I like it. It gives me very good access to the area. It's easy for me to lift up the breast and muscle, develop the pocket in a very precise fashion, and really put the implants close together so I can achieve a really nice natural cleavage. What I've seen is for patients who've had other types, for example, the armpit incisions, I've seen cases where patients have come to me having this transaxillary procedure done maybe years ago, and their implants are really far apart. And I understand the reason for that. It's because probably when the surgeon was trying to dissect it, it was too far from the armpits to really get nice cleavage. And I think, for me, one of the important aesthetic goals for breast augmentation surgery is to really get nice cleavage, really. And so I think that inframammary fold incision works really well for both me and my patients. Second decision they'll have to make is sort of silicone and saline. And there's really a number of differences between the two. I would say in my practice, the most common reason people choose silicone is because it really feels more natural. It's a slightly newer implant, but it's been very heavily vetted by the FDA and ensured to be very safe. But overall, that's the major reason people choose, is because it just feels more natural. In my practice nowadays, I'd say again over probably 90% of patients are doing silicone, and there's still a small proportion of patients that do saline, and saline is also a great implant as well. In terms of the procedure, what patients can expect, it usually lasts about an hour and a half. The idea really is to make first that incision. I'll talk about the inframammary fold one since that's the most common one I do. Small incision underneath the breast, and then basically lifting up the breast tissue as well as the muscle to really develop a pocket underneath the muscle. In my patients, probably most of my patients, I put the implant underneath the muscle, and that's because the research over time has shown us that the long-term results with the implant under the muscle seem to be better. There's a less chance of infection, less long-term complications with the implant. Overall, things just seem to be better in general, and so that's what I choose for most of my patients. Lift everything up, and once I've developed the pocket, I put a temporary implant inside the patient at the time. We'll set them up on the operating room table, assess for symmetry, make small adjustments to the pocket to make sure things look nice and even. Then once I'm happy, put the patient back down, temporary implants come out, and we put in the final implants. Everything is washed with triple antibiotics to minimize the chance of infection or capsular contracture or things like that. And overall, then at that point, the skin's just sewn up and you're all finished. So patients asleep the whole time. It's pretty straightforward. Patients usually on pain medications about 5 days or so. I've had patients off pain medications by 2 days, but that's an anomaly. I would say usually to plan around 5 days or so. After the surgery, basically I have patients in a surgical bra with a lot of dressings in the area just to make sure everything heals well. I tell patients just leave it alone, don't have to do anything with it until I see them back at their first post-operative appointment. At that point, I'll take things down, double check for signs of infection, and at that point, since the swelling is still going to be there, we wait for a few weeks for the swelling to come down, and then over the following few months, the breast shape continues to improve as the skin slowly stretches out and the breast implants start to descend a little bit. As I said, overall, it's a straightforward procedure, hour and a half long. The most popular procedure among plastic surgeons, and for me, the most popular non-facial procedure that I perform. And it works pretty well.